One of my patients, it was actually her partner who found that she's got a lump, and he said, you know what, this is abnormal, and she kept on brushing it aside. And you know, because your partner will feel, you know, when people are playing around or intimate, and he generally likes to hug her in the morning, and then one morning is like, I feel something different, you know, and it's important as well to know your own body and even your partner's body as well, because breast cancer, people just, it's not us who diagnose breast cancer actually, or anyone in the health, it's you as the patient, it's you as your partner who's saying, wait a minute, something is wrong, let us seek help. So I always encourage women to do a self-breast examination, and the ideal time to do a self-breast examination, you can do it after your period, which is once a month, so it's regular.
I'm curious to know when you go in for an operation for this lump, or let's call it the cancer, to be removed. Can you explain to us when they say we didn't get it all or we got it all? What does that mean?
Technology has advanced where they can do what's called breast conservation surgery. So your surgeon would look at you, look at the shape of your breast as well, feel where the lump is. And then they, remember I said we do images as well beforehand, because then they can start planning their surgery to say, okay, the lump is there, this is how we go in. So they would cut out this lump and cut out a little bit of normal tissue as well around the lump, and then you send it off to the lab. Okay, there in the lab, the pathologist, so that's the doctor who specializes in looking at cells, would then say, okay, this is the tissue that we've received, this is the size of the tissue, this is the cancerous lump, this is the size of the lump. And then they also look at the tissue around. Remember I said you must take a little bit of normal tissue around, then they'd look
to make sure that
so they would measure how much normal tissue that there is. And what we want is that the whole lump must come out, and there must be normal tissue as well. So they are not what we call positive margins. So a positive margin would mean that there's microscopic evidence of cancer cells that go to the line which they have taken out.
If I'm to use an example to make it relatable, if you have an avocado and it's got a bruise, you're not going to cut right against the edge of the bruise because you want to eat the fresh part. You cut still a little bit of fresh avo, you take out the bruised bits, and you're left with your... Is that a good way to explain it?
That's actually a beautiful way, which I'm going to use as well. So the psychological aspect it starts from the word go, where you've got someone to support you. The first doctor or nurse does the counseling, and then you move to the oncologist where they will do an examination, discuss, as we are discussing what it is, cancer, finding out what your symptoms are, and then we need to stage, because that's the most important part.